We are excited here for panel number 2, the industry panel. And I am honored to be here today as your MC, Mr. Rob Jones with the College Success Foundation. I am also a college prep advisor and have been doing that work for 15 years, serving low income and first-gen students that have a desire to go and pursue college. And I get the chance and the privilege of working at one of the best high schools, not only in the city and the state, but I believe in the nation, and that is Lincoln High School on the east side of Tacoma. But today, I get to allow what I do as far as my work be off a little bit to the side and now really get to spread my wings. I really get to a chance to connect with students from all over the state. And what we're going to do today is we are going to just talk and have some questions with our panelists that is here from the industry. And I'm hoping today that many of you have a piece of paper. I'm hoping that you're writing notes, and we're going to hopefully give you a chance at the end to be able to ask some questions. And so kind of like how we'll go pretty much like it was in your first session, we're going to have rapid questions, and then we're going to have some questions that we're going to ask directly to the panelists. And then hopefully after that, you will be able to then ask your own questions if you have some. In the meantime, we're asking that if you can, try to keep your phones on mute to be respectful for that. And if we can, just try to hold our questions to the end. So that way our panelists, they can get out what it is they feel that they would like to share with you. And as I mentioned before, this is very important to say, what you're doing right now is called networking. And this is a very an important piece for high school students making that jump to college. So let's make sure today that you're taking notes, making sure that if there's someone that really captures or captivates your mind or your attention, make sure you get their information. So if you need to follow up with them, you can so and do so in a timely fashion. But without further ado, it is time for me to stop talking. And it is time for me now to introduce who the superstars really are that you came to listen to today. And so with that being said, we are going to go ahead and introduce our panelists for today. And we are going to start off first. And I'm going to ask when I do say your name, if you would just wave so the students can see who you are, and we'll go from there. We're going to start off with Ms. Charlotte Sanders, who is she's a teaching associate with the University of Washington in the School of Social Work. So Ms. Charlotte, she's already waved her hand. Thank you so much. Ms. Salome Valencia, who works with a clinical social worker and is part of a group that practices servicing BIPOC patients in the community. Are you with us still?
She should be, but she has not been moved over yet.
Oh, she has not been. Okay, thank you for that. Next, we have Dr. Angie Conklin, who is an RN with Multi-Care Novels Hospital, and she's an administrator clinical. And so want to make sure if Ms. Conklin, you are here. Okay, good to see you again. And then next we have Dr. Kimberly Appleby. If she could just wave her hand, she is there with the mask. Thank you, Dr. Appleby, for being here. She is an RN, BSN, and MSN administrator of nursing of Multi-Care. So we're glad that you are here. And then Dr. Thomas, if you can just wave your hand. Thank you, sir. With Kaiser Permanente of Washington's current medical director for healthcare and career pathways. And so, okay, Dr. Appleby, I stand corrected. You're not a doctor, but you are a nurse. My apologies for that. I don't want to give people the wrong title. So if I did do that, my apologies. I mean that sincerely. I'm going to go ahead, stop talking because I'm obviously excited, but I want to make sure that now we get a chance to ask our panelists some questions. And so what we're going to do rapid questions. And we're just going to ask you a series of questions. And we're going to ask for you to put up with the white piece of paper, yes or no. And I believe I made another mistake. We need to go ahead and introduce 2 more of our panelists today. I did this for the second time. And so I'm going to ask you, since I already messed up, if you would please go ahead and introduce yourself. You have the floor. Again, my apologies.
No problem. Hi guys, my name is Marissa Robinson. I'm a third-year family medicine resident at Tacoma Family Medicine. Just to give you context, resident, I've graduated medical school. I'm in my final year of postgraduate training. I'll be finished on June 30th. I work at Tacoma General on the inpatient wards, as well as doing OB and in the clinic.
Everyone, my name is Salome Valencia Bonet. I am a clinical/medical social worker. I was a mental health program supervisor for an outpatient clinic. I supervised seasoned clinicians as well as created and supported a training program for MSW students. And I was also a program manager for a residential facility for youth who had mental health disorders as well as disabilities. And I'm currently switching over to a private practice / group practice. Thank you.
Thank you. I believe we have one more panelist.
Yes, hi, I'm Anique Lennon. It's nice to see you all. I am a disease research and intervention specialist at Public Health Seattle and King County. Basically what I do is look at data about the pandemic that we're all living through right now and make sure that it's accessible and usable as quickly as possible to the public and to people who are making decisions about what's happening in our community. So if you'd like to know more about that, you can go on kingcounty.gov and look at some of the data dashboards that we have in the COVID-19 section and know that I'm the person behind those dashboards, or well, at least one of them.
Well, thank you. Thank you. Can we snap it up for our presenters on today? Appreciate that. Appreciate that. I know that we wish that we could all be in person, but we are doing the best that we can, and we're going to pivot and adjust to that. And I would just like to say this. I made this quote to our last group, and I would like to say this to our students here. Excuses don't achieve goals. Excuses don't achieve goals. And today you are making a step that shows that you have interest in your career, you're concerned about it, and obviously you are here spending time that you could have done, whether it was working on your job or maybe your sports team. You decided today this hour and a half was worth it for you to listen to professionals that really you're trying to decide if this is a career path you want to go down. And so for that today, we applaud you. And now we are going to begin our session here. So let's go ahead and start with the first questions. Panelists, I'm going to ask you to have your papers ready so we can quickly get through this. People are already putting up the yeses. So here we go. All right, students, get ready. Make sure you are paying attention. First question. Was one of your favorite classes in high school math, chemistry, or biology? Thank you. Next question. Did you like the creative arts, that being music, dance, or art? Okay, got some very artistic people here. I like that. Did you consider yourself a people's person? So everyone here is telling the truth. Yes. Did you always want to go to college? Students, pay attention. Everyone didn't have the desire to want to go to college right after high school. And you're seeing it right here, right now. However, it's not about how you start, but how you finish. Did you always know that you wanted a career in the healthcare field, or I believe someone had mentioned before, the medical field? Wow. As you can tell, these are all not yeses. A lot of no's on there. Did you have a family member? Do you have a family member that works in healthcare? Wow. A few yeses, but quite a few no's. Are you the first generation in your family to go to college? Okay, there you go. A few no's, but obviously we got some yeses in there. So young people, if you are the first in your family to go off to college, you are not by yourself. There are people out there that have already paved the path to let you know that it can be done. And today we're encouraging you to let you know that it can be done for you as well. Next question. Did you receive at least one scholarship or any funding to help pay for college? Okay, quite a few yeses. Okay. Want to go to the next question? Did you attend community college? Wow. And I think this is very important. I appreciate that. I think it's very important that we say this. Not everyone is meant to go off to a four-year college right away. It could be due to finances. It could be due to the fact that maybe you just don't really understand what you want to do. But just know, if you don't go off to a four-year college, the world is not over. Did you struggle the first year of college? Oh, Dr. Robinson was a perfect student, so no, she did not struggle, but everyone else did. So thank you for your answers.
The second year slump is real. Just
There you go. I hear you. Next question. Did you work a job during college? Okay. One person said no, but I guarantee he was busy with the books. And so as you can tell, many of the panelists here today, they were doing other things than just being a student. So appreciate that. Thank you. Did you, okay, here we go. Now we're about to open it up. Did you ever say no to a party or social outing so you could study? Wow. So for all of you that make excuses saying that, well, I have to go here and here, you're seeing people now that had to make some sacrifices. Did you ever say yes to a party or social outing when you should have been studying? So as you can tell, they're human and they were young and they had to go through their trials and tribulations just like you will. Did you ever visit your college professors for extra instruction during college? Absolutely 100%. And I can almost guarantee they probably had the same mentality when they were in high school, which has led them to the success that they currently have right now. Did you ever use tutoring or other resources to help you succeed in college? Absolutely. Young people, as a product of someone who went to school and received an academic scholarship, I was in the tutoring and math lab and writing lab 4 days a week outside of track practice. It was crucial. And obviously you can tell right now that our panelists are saying the same thing. Have you had a mentor to help you during your academic career? Wow, thank you for that. You can't do this thing by yourself called life. Did you sometimes feel disappointed or sad? And I know we can elaborate on that, but thank you for that. Yeses. So as you can tell, that if you feel like you've gone through disappointment or failures or setbacks, just know you're not by yourself. Success does not come with the easy road. It will come with challenges and obstacles, and you're hearing it right now. Have you ever made a big mistake? It's called life, people. All of us will make it. But how you learn and how you adjust to that is what's important. Did you ever get the sense that someone did not believe in you? We call those today haters. But let me just say that though, you can have the same people in your family that may not believe in you. Your friends may not believe in you. Some teachers have probably said that you're not going to be successful. But I'm here to say, keep pushing and finish on empty. If you have someone that did say that they did not believe in you, did you prove them wrong? And to prove someone wrong, you can still do it with class and dignity and still show them love. Keep pushing. So that concludes our rapid questions. And now what we're going to do is we're going to move into 7 questions that we would like to ask our panelists. So we're going to ask our panelists to come off mute. And again, just like we did the last session, for any of you that feel comfortable in addressing and you can switch it around this session, we would like to hear from several of you for each question if that's possible. And we're going to try to do our best to get the questions answered. by the time allotment that's been given to us, but if not, we're going to enjoy the time that we have. So question number 1. What is your story? How did you get interested in pursuing medicine or the health field? So any of our panelists, come off mute and go ahead and answer. I believe, Dr. Charlotte, you were on your way of addressing it. Oh, okay.
I'll go ahead and launch into that one. So
Okay.
I actually really loved learning when I was a kid, and I wanted to be an astronaut. Actually, I saw a movie and it inspired me, but it didn't happen. But it still got me up to studying hard, and it motivated me, and that's what mattered. And but because of that, I wanted to get a PhD in astronomy. So I studied really hard, but I found myself in high school really doing a lot of social movement things, social justice stuff. I took a year off between high school and college. I did volunteer work. And when I went to college, realized I wanted to do something I could really interact with people doing. So I didn't think about medicine at all. But when I went to college, I went to a historically Black college, first of all. That made a huge difference. My parents said, if you're going to be in science and you're a Black male, go to a Black college. So I did. And then I had all kinds of mentors. And one of them was a physician who said, you'd be a good doctor. So that's how I ended up here instead of at an astrophysics observatory.
Dr. Thomas, you keep surprising us. You keep surprising us. And just to let you know that my aunt went to Spelman. So I congratulate you. Yes, sir. Anyone else, would you like to chime in?
Hi, this is Angie. I'll chime in. So I actually went to community college about 3 years after I graduated high school and had a baby, and wasn't really sure what I wanted to do. And my brother, who's 1.5 years older than I am, was in a violent something violent happened to him, and he was not doing well, and he was admitted to the ICU. So my dad came and got me, and I went to the ICU, and I didn't even recognize my brother. What happened was he was beaten very badly with a baseball bat. And so he was in the hospital for over a month, and I sat with him and watched what the nurses did. And that's when I said, that's what I want to do. And went to school, went to a community college, went and got my BSN later on. And right now I'm actually in MSN program for nursing for leadership. So, and hey guys, I'm 60 years old. So you know what, you can do it whenever you need to do it. So just keep going and keep pushing and keep learning.
Age is nothing but a number. Thank you, Ms. Conklin, for sharing that. And I would just like to add to this, usually most times out of passion, it comes from something that is challenging or something that is difficult. So as our panelists even alluded in our last session, many of their passion of where it came from something that was a struggle. So young people, as you go through, don't feel awkward if you're wondering, why do you have this passion? Sometimes there's a reason for that. Our next question. As a BIPOC, what kind of barriers did you face when pursuing your medical degree? And how did you navigate those challenges and barriers? So there's 2 parts to the question. So would anyone like to start off with that? Yes, Dr. Shaw.
Or not a medical degree, but I have a degree in master's in social work, which is a healthcare, health science degree. And when you asked this question in the other room, all I could think about was everything. Everything felt like a barrier. I'm first generation, both my undergrad and grad school. I didn't have any money. I worked as a entry-level social service person, didn't have any guidance, didn't have pretty much everything that you would hope to have when you're going into school. Didn't have a lot of people saying, yay, that's a great idea. All I had were, what are you trying to do? What do you Why are you trying to rack up $100, $1,000 bills just to go to school? And so everything felt like it was a barrier. Even being in school, not seeing many people that look like me, or who came from where I came from. I'm also from the Yakima Valley, Salome, and that's hard when you are trying to spread your wings and not know really where you're going. How did I navigate those challenges and barriers? All it took was my mom. She was probably the biggest cheerleader I had, and she herself not having any idea. So you hang on to those people who are encouragers, who are supporters. The other way that I navigate, and even now that I've learned so much in my many years of life, is that you need to become comfortable leaning into discomfort. Everything felt uncomfortable. And if I responded to that discomfort by running away or being discouraged, I would not be where I'm at today. So that's something that I tell students that I work with now at the University of Washington, is that's the biggest piece of advice, is being aware of what makes you feel really uncomfortable and leaning into that and figuring out why and figuring out how to get through. So.
We need to stop and hand clap, please. Yes, let's just do that for about 2 seconds. Let's go ahead and do that. Thank you. Don't be stingy with your fingertips. Good to can clap. Davison Eisenhower, we love Yakima Valley. I think it's a beautiful place, but your words today definitely hit it off. So thank you for that. Well said. Anyone else would you like to chime in before we go to our next question? And if not, I'll go ahead. Okay. Next question is, can you speak on the need for more BIPOC doctors and faculty within the medical community?
So like Charlotte, I'm a medical/clinical social worker. And for me, it was always wanting to see more representation in the health field. Many of the people, while they were good intentioned, did not look like me, have the same experiences as myself, did not, because I was a first generation, not only within college, but also with being a citizen of the United States, that they did not understand the struggles that I had. And when I tried to have these conversations with them, when I would interpret in the hospital for my father, who was going through chemo treatment, they would say things to me, and they were trying to be nice, but I would always be like, there's an insult in there. And so it was really, really hard. It was a constant struggle, and always trying my hardest to be polite and receptive, and me needing to be that on my end, where they didn't see or acknowledge how they also needed to be that way on their end. I was the one that was always wrong, and they were always ones right, and they were trying to help mold me and shape me into what they thought was a good American citizen. And so for me, I made the decision that I wanted to enter into the healthcare field so that I could support other Latinos, and then also so that I could be able to uplift their voices, so I can share the experiences that they're having, and let them know that they are not alone, that their voices do matter. And they may feel that they're being silenced, or that their perspectives aren't honored. But together we could work together to change the system, and we could work together to ensure that the narratives that they have within the hospital are changed, because those narratives, they really impact what kind of medical treatment you're receiving. If you, like me, come from a family that does not speak English, that is lower income, then the medical services that you may be receiving may be lesser than other people who come from influential and powerful backgrounds. And so for me, that representation, again, just really, really matters, to have that advocate in that hospital or in that outpatient clinic that could support me and be on my side.
Young people, I hope that you are sincerely paying attention to this. Again, thank you so much for just your transparency and openness with that response. We are going to try to ask at least maybe one or two more questions, because I want to make sure we can go to our chat in case a few of you have questions that you want to ask the panelists. But we didn't get a chance to ask this in our last session, so hopefully we can ask it right now. This is a good question. How did you navigate your personal life, family responsibilities, self-insecurities, and other barriers to get to where you are today? I'm gonna read that one more time. And I'm hoping that for those who didn't get a chance to speak yet, our panelists, we're hoping that you would speak, because all of you have something great to say. The question is this: how did you navigate your personal life, family responsibilities, self-insecurities, and other barriers to get to where you are today? That's a good question. Who would like to take an approach to that?
You know, there are multiple good questions that I could focus on. And I think I want to kind of point out the self-insecurities portion immediately. I know imposter syndrome is real, and you think that you shake, and just kind of give some context. Try to explain. It's you being in a space more or less where you think you do not deserve to be in this space, and you use these in your head, and it's mostly in your head, but sometimes reinforced by the very real structural barriers and inequalities that you're living through, and oftentimes are not perceived by your other colleagues who may be from the dominant, whether that's racial minority, socioeconomic minority, goodness, even gender, whatever spectrum of gender minority you might come from, and really believing that you don't belong there despite all the evidence that might be pointing to the contrary. And this has been plaguing me ever since I was in undergrad. I would even say go back to even medical school. And I want to bring it up here in terms of how to cope. Initially, I didn't cope too well with it. In medical school, I really had a lot of social isolation. I went from, I'm Jamaican, I explained that earlier. Born and raised in Jamaica, I came to the States. I went to Iowa, Grinnell College for undergrad on a scholarship, wonderful institution, had a great community of international students as well, African and Caribbean diaspora to support me. Then I went to medical school where there were 13 underrepresented minorities by definition, 3 from the African diaspora, and 1 that was African American, even at that. So very, very scant representation. And I did not cope well with that. I thought, goodness gracious, I am only here because I am Black and I need to add to their numbers so they can continue getting their grants. And it took a lot of self-reflection and, more importantly, finding community. So the way I did that was through mentorship. I had to find people, and I wound up on my favorite and best mentor is a wonderful lady, Dr. Martinez. She's a family medicine physician who identifies as Latinx. And she kind of just picked me up first year. I found lots of support through professional networks. So there's a great organization called the Student National Medical Association, where I went from seeing 3 other Black students. So I went to this massive national convention, and here were all these, oh my gosh, they're Black doctors. There are so many Black doctors in America. This is amazing. And just being surrounded by people who get it and who could recognize with my experience, that was so powerful to experience as a first year in medical school, and really was a driving motivator to help push me through the rest of my time. In fact, to the point that I worked on admissions for the University of Iowa for 2 years, talking about these very things, or lived experiences and the differences in which how we experience our life, because many of us are working multiple jobs, we don't necessarily have the time to just sit in the library all the time to be cranking out these 5.0 GPAs. We have so much growth in our life that oftentimes is not shared by others, and being compared by in a very superficial nature as you're trying to get into medicine and get your way through medicine, it's tough, and you don't get the same opportunities that some of your colleagues do, unfortunately. And so trying to be an advocate for voices that way. And then the other thing I wanted to point out was the kind of just professional way of things. So, in medical school, I didn't have a clue. I came in I did it all myself. None of my family really did any healthcare stuff. When I got into med school, literally someone in my college said, you? Like that kind of scenario, you know? Because I didn't advertise myself. I kind of just stayed under the radar and didn't make a big fuss, you know, did took my hits when I got them and just pushed on through. Got to medical school, and lots of legacy you'll see in medical school. Lots of people whose families have been through this kind of scenario before. They have multiple generations of physicians. And I didn't know, you know, I had no idea what a shelf exam was, had no idea what matching was, what in the world is match day, didn't know what all the specialties were. Kind of just figuring it out as I went. And the mentorship here was important. Really, really just finding someone who you can sit down and be very frank with and not have to feel like you're putting up a facade. So sorry, that was a long-winded explanation as to say, know thyself and ask for help. You're not alone. You might feel that you're alone. You might feel that I am the only one here who doesn't get it. You probably are the only one here, or one of a few people who do get it and are willing to come out and say what is real.
Dr. Robinson, we appreciate that passion, and we appreciate that Caribbean infusion. So thank you so much for that. Definitely, it puts us in a calm. Would anyone else, the panels that have not spoken yet, would you like to chime in, whether that be Ms. Appleby or to anyone else that I have not had a chance to hear from? Would you like to go ahead and chime in?
Remind me, the question was the balance, correct?
Yes, so the balance of dealing with, and it's a loaded question, but it was dealing with how do you navigate your personal life, family responsibilities, self-insecurities, and other barriers to get where you are today?
That's so many questions in one. I think I'm a very young nursing leader. I'll speak very frankly to that. So there's been lots of hard work, lots of tears, lots of sacrificed events. And I think reflecting back, I would tell any young person to really find that balance as you pursue your passions. You know, there's going to be hard work, but also pause to ask, is this a moment that you can't get back? And so really making sure you're present with your family, with your friends, because the work will always be there. There's always tomorrow. So really finding that balance between pushing hard, but also not pushing to where you miss opportunities that you can't get back.
Just did a Geico moment. Anyone else that would like to add to the question, or would you like me to just go ahead and move on to our last question due to time?
I'm just going to very quickly add that the barriers that you're going to face are going to be different than your peers. And you may ask a lot of questions of why do I have to go through this? Why is this happening to me? But just keep pushing through. There are others before you who've also gone through it. Look to them and ask them, you know, how did you manage? Also know that you have that strength in yourself. You made it this far and you can keep going, and your dreams are worth it. I also wanted to speak to that as a Latina, I realized that I had to work harder than my peers. I realized that I was fighting discrimination, conscious and unconscious, and that I had to constantly prove myself over and over and over again. And I had to take on opportunities or volunteer opportunities that my peers didn't have to, because I needed to do the networking, that they already had that networking built in. And so just know that you are going to go through a lot, but you can do it. And when you have opportunities presented to you, yes, weigh the pros and cons of saying no to them or yes to them, but also recognize that you're doing this for yourself, but also for your community, so that hopefully your brothers or sisters will be able to have that future that you're trying to gain for yourself. They could see that it's possible, and that they'll later look to you and be like, you know, how did you do this? Can you give me that advice that, you know, of what you went through and how you overcame the struggles?
Thank you for that. Wow. Anyone else? Anyone else want to, this is a very important question. I know it's compounded, but would anyone else like to add to that? And if not, that's totally fine. Okay. All right, we'll go to our last question, I believe. And Ms. Swanson, if you want to go ahead and after this question, we can ask or address the chat room. But the question I was going to give here is, what do you know now that you wish you knew then? We'll end with that. What do you know now that you wish you knew then? Hindsight is always 20/20. So what do you know now that you wish you knew then that you could share with our students on today?
I would say be grateful. I carried a lot of anger throughout my years. As a therapist, I also went through therapy, and having to experience systemic racism, other forms of discrimination. And I had one situation in particular that it affected me medically. I was on medication to help me get through my practicum, and it was so bad. And know that your ancestors went through this, they went through the struggles, and you were here because they went through those struggles. You going through these struggles, the people, then the legacy that you're leaving behind you, you're paving a path for them. And it's important to be grateful that you are able to do these things, that you are here on this earth, and that you are able to live another day. Everything is hard for us. It's the US. As you can tell by what you're watching on your TV screens, what you're experiencing, it is hard to be BIPOC. But when you're grateful, you're able to not carry that anger. You're able to let it go, and you're able to keep moving forward, and to not let it shade and color other parts of your life that you can find joy and happiness in.
Anyone else, would you like to add to that? Share with that, your insight, your perspectives on, and the question is, what do you know now that you wish you knew then?
I'd like to speak to two things: failure and also spiritual centering, because I think I had some late failures. I got actually through college okay, medical school okay, and then I got through my residency, and then I had this huge failure where I had to eventually resign and then move to a different state. And then I think what really got me through was the understanding of myself as a spiritual person. My grandmother's favorite quote was that to seek first the kingdom of heaven and all else will be added unto you. And I just never forgot that. And there's no way I would have gotten through. I mean, there were just so many times I would have fallen if I didn't have that spiritual centering.
Preach. Son of a pastor, I had to say that. Anyone else? Ms. Anique, would you like to share? Oh, yes, go ahead. I'm sorry. Anyone who would like to speak? Yes, go ahead. Dr. Charlotte, go ahead.
Oh, so I would like to second that, Dr. Thomas. I think that we all need to figure out what our healing and where our healing comes from, just as a life practice. But especially if you are doing something as wonderfully difficult as pursuing your education, breaking into areas where maybe no one has done before you within the relationships that you had. So I feel like looking for those relationships, that to me, that's a healing practice of creating the relationships, be relational with each other. You're doing these great, fantastic gatherings like this, and you're meeting other people who have similar minds, similar goals, connecting with people who have that, and that you can reciprocate that encouragement. And one thing that I regret is I didn't make relationships as I went along the way. I maintained my isolation for quite a while in my own little bubble. And I wish that I would have created more relationships. I didn't figure that out until my graduate program. So that's what I would encourage you to do, is build relationships with other people.
Thank you, thank you. I know we're over time, but I'll have to get in trouble because this is good stuff. Would anyone else like to chime in? I want to make sure that our students hear from you. They are obviously here to hear you. So would anyone else have any parting words for our attendees today? Any of our panelists?
Reach out to me if you have questions, I'll be working as faculty in the area, or not faculty, hopefully faculty, but working as an attending in the area starting in January. If you need shadowing hours, I know how tough that can be. If you just want to see what it's like to be a family medicine doc, I'll be doing OB, I'll be doing clinic, I do tons of procedures. I see, it's womb to tomb, so I see babies right up to, geriatric. Please reach out to me. I'm always happy to help. You can have my email, you can have my cell phone. I'll be in Jamaica for 6 months on the beach, so maybe not then, but January 2022, I'll be back.
We love that energy, love that excitement. Yeah, bring back some of that beach with you too, for sure. Without further ado though, we're going to try to honor our time, and I want to hand it over to Swanson. If there's anything that you want to share in the chat before we go ahead and transfer out.
I just want to say a huge thank you to everyone. I mean, this has been, I've been involved kind of with this group in the early infancy, and I can say the panels every year get better and better and better. And it's always so inspiring. There's just so many lessons to be learned and knowledge to be shared. And I cannot thank you all for taking time to do this. So I just really, really wanted to thank you. And if there's anybody that has a question that you want to just kind of get in at the last minute, this is your one chance.
KP
Okay,
is
and-
building shadowing programs. We're trying to kind of do it slowly. We don't have a lot of things, but we've got a virtual shadowing for high school students who are from underrepresented minority backgrounds. You can email me. I put my email in the chat. And I hope the other presenters also email me because I want to meet you guys.
Any of the presenters with any last words before we go? We want to give you the floor. If not, I just want to say this to the students that are here, and oftentimes I use this with my athletes, and I use the whole thing about don't run to the finish line, run through the finish line. So with your passion, with your career path and everything that you're going through right now in life, and many of you are in high school, don't run to the finish line, run past it. And everything that you do. And I hope today, this panel and the group of panelists that were here, you got something from it. Take it, absorb it, and now apply it and run with it. With that being said, Ms. Swanson, I'm not quite sure what you want to do now, but if that's it, that concludes our presentation. And I'm just hoping that we can give our panelists a hand clap or some snaps, just to let them know we appreciate you taking time away from your work, your life, to impart it to us. With that being said, thank you so much.
Thank you.
Thank you, thank you, thank you. Thank you. Thank you, thank you. And to Ms.
Thank you
Conklin,
so much.
I just want to say this. If I could see you, I would give you a hug for your bravery and sharing with us today. I know that was emotional, but just knowing that we appreciated your transparency. Thank you so much.